Hello and welcome to Don't Tell Me to Relax, the fertility podcast here to guide you through the roller coaster of trying to conceive. I'm Hannah, your host, a fertility acupuncturist with clinics in London and across the UK. Our patients tell us how frustrated they feel about their lack of fertility education. So this podcast aims to provide all that education they never taught you in school, with the aim of putting you back in control of your fertility journey. We also have our fertility community to help address isolation and provide further information and support. To join us, the link is in the show notes.
Hello, are you an acupuncturist with a keen interest in food? Join our Chinese Medicine Nutrition Diploma, an online course delivered 2 hours per week over 30 weeks, which starts this October. Enhance your clinical outcomes with contemporary nutrition perspectives and practical knowledge of East Asian food traditions. Learn from a team of experts covering topics from gut health to fertility, medicinal mushrooms to fermentation, food for cognitive health, and so much more. Check out the courses page on our website, thepractitionerhub.co.uk, for more.
Hello everyone, and in this episode of Don't Tell Me to Relax, we are going to be talking all about the main event of your menstrual cycle, which is ovulation. So ovulation is something, I don't know, I worry about when I think back and think about what did I think about menstrual cycles when I was younger. I did not have a clue about ovulation, about releasing an egg, about, how long you were fertile for. So, Katie, what about you? What was your understanding of ovulation when you were younger?
I actually have no idea.
Your pause then says it all. You're like, nothing. There was nothing.
No, like as you were talking then, I was like, we must have got taught about it, but I don't know when I learned about it, which says a lot.
Yeah.
And yeah, I think it wasn't until I really started getting into like working in the fertility world of being like, oh, you're not fertile for very long at all.
Yeah.
Yeah. So I don't know. But yeah, I didn't really know about it.
Yeah. So if this is all new to you and you're listening to this, then you are not alone, because we have all been there. We've all been there in that level of confusion about what is actually going on in ovulation. So Katie, tell us what's happening when you are ovulating.
So as we've talked about in the last couple of episodes, so far everything's been like leading up to this moment. So your estrogen's been rising, then you had that LH surge, and that's what triggers ovulation to happen. But ovulation is when that egg is released from the follicles. So when Hannah was geeking out about follicles last week, the egg has to burst out of that. So that's the main thing. And then once that egg is released, there's about 12 to 24 hours where it can be fertilized. But as we were sort of saying previously, like there's various things that happen with your body that mean you're fertile for longer than that. Because imagine if you only had that 12 to 24 hours to try and conceive, it would just be a nightmare.
It would be even harder than it already is.
So Hannah, how long are we actually fertile for?
It's a very good question. And I guess the thing is like, as you said, your egg only survives 12 to 24 hours. So it's a very, very short window. But the reason that you are fertile for longer is because sperm can stay alive within the cervical mucus, within the fallopian tubes. So it means that you are potentially fertile for about 3 to 5 to 6 days, some books say. But I think really it's all a bit of a window, because we are all unique and different, and I think that it's not the same for everybody, so you can't be definitive about it. It's a rough estimation, and it is definitely a window rather than one specific point of time, because if you had sex 2 days before you ovulated and the sperm's lovely and in that cervical mucus and it's been traveling up through into the fallopian tube and it's sitting there for a couple of days, and the minute you ovulate, the egg and the sperm meet, then there we go. You've sort of had that window of opportunity has kind of been those 2 days. So that is why we always sort of refer to your fertile window as opposed to a specific point in time. But also what's really interesting is that, men are fertile every single day of their life, assuming they have no problem with their sperm. And women are fertile, as we've just said, for approximately 1 to 3 to 5 days. And yet, Katie, you know what I'm going to say?
I don't want you to say it, but yeah.
All contraception in that is available other than condoms focuses on the female's fertility, and yet she is the one that is hardly ever fertile. So it really is bonkers that we have not progressed in any way and developed contraception that is aimed at men who are basically fertile all the time. And when you're trying to not get pregnant, it's that bloody sperm production that is the problem, rather than, you know, a woman producing one egg every single cycle. So anyway, I'm just going to put that there because it's an interesting fact. But the other thing that I was going to say is that your fertility, even if you have no underlying issues, so even if there's no health issues, no fertility issues, they estimate, and again, it's a window and it's an estimation, that you have approximately a 20 to 30% chance of conception happening. So even if you're having sex at the right time, you've ovulated, the sperm is good, the tubes are open, sperm and egg have got the potential to meet, there's only a 20 to 30% chance of that happening. And why it doesn't happen all the time automatically if all the parameters are right, nobody really knows and nobody really understands. And what's interesting is that IVF stats mirror natural fertility. So statistically, IVF is around 30, it sits at around 30, sometimes it goes up to 40, 50%, so many factors involved. And I would say that natural fertility is the same. So that's a good statistic to hold on to, because I think it really helps manage your expectations of how long it takes to get pregnant. So, you know, this idea that we've talked about many times on the podcast, that when you have unprotected sex, you will get pregnant, is just not realistic. And the fact that we were sold that when we were younger and the way that we are given our contraception really does not help manage our expectations.
God, 100%. And I actually love that statistic of how even in a healthy couple where everything's like all good, there is 20 to 30% chances of conceiving. Like, I hope that people find that like really reassuring, and just to kind of be like, you can be doing it all, but like nature will do its thing, and it doesn't always happen, and like that's like quite normal. I think that's the thing to take from it, that's the reassuring bit. And then also just anyone that's my generation that was brought up on Mean Girls, where they're like, don't have sex because you will get pregnant and die. And it's like, I just had that like in the back of my head growing up. Like, that was basically my sex education. So, you know. But
Mean Girls.
Yeah. Don't have sex because you'll get pregnant and die.
Yeah.
So...
Yeah. It's interesting, isn't it? And I guess the thing is that for most people, you don't want to get pregnant when you're a teenager.
No.
And I guess the thing is that when you're a teenager, and I might be making a generalization, you sort of tend to have quite a lot of sex because your hormones are quite high. You know, like if you're having good sex and you just discover it, you know, it's quite. So maybe that combination, you know, means that there's a higher risk because you're having more sex and you're young and all of those kind of things. So I'm not saying it's not a message to have. It's just the understanding of it is not. It's not true, is it? And it's not.
No.
It's not helpful. I don't think.
No, and like that whole thing that you said about contraception being like aimed at females, and how that makes people feel when they're taking it, and the fact that we're fertile for such a short window. I mean, I could rant about that for a very long time.
Yeah.
But
I mean, the fact that you take a pill every single day to shut off an event that only happens for a very short period of time is actual insanity when you actually think about it.
Yeah. Don't get me started, because I find it infuriating that is the case, and just how so many people, like the amount of, so I'm at the age where a lot of my friends are like starting to have babies and things, and we're like, a lot of them were put on the pill at like 16, 17, and now they're coming off it, and they're like, I feel like a different person. Like, I didn't know this is what I would feel like, and I feel like a cloud's been lifted, like this fog's just gone, and got all this like energy and libido and all these things, and it's just like, gosh, it's bonkers. Like,
yeah, it is. But that's a whole other episode, Katie.
It is.
So tell me, how do we know that we're ovulating? How, if you're going around your business, what are you looking for to tell you that you're about to ovulate or that you are ovulating?
So key things are mucus. So if you're seeing mucus before ovulation, And I know I've been guilty of being on Instagram, literally cracking an egg and like playing with the egg white between my fingers and being like, this is what mucus looks like. But if you're also seeing anything that's kind of, it's still stretchy, but maybe it's more sticky, more white, like stretches a bit between your fingers, still has a kind of smooth or slippery sensation when you're wiping, like that's still fertile. So if you don't see the crystal clear, super stretchy stuff, like don't panic necessarily, because so long as you're seeing any kind of mucus that is something you could pick up off your toilet paper essentially, then you can consider that to be fertile. So looking out for your mucus and having sex on like the days you're seeing mucus is really, really important, as that's kind of telling you ovulation is approaching. As we talked about last time, your cervical position changes as well. And then once you have ovulated, your BBT will go up. So that's your basal body temperature. If you're taking your temperature first thing in the morning, then you should see that go up and it should stay up. So that's like an indicator that you have ovulated, as once you've ovulated, progesterone kicks in and that has this heating effect on the body. So that's why we can use BBT as a way of seeing if we have ovulated that cycle. I think they're the main things. Is there any, I'm not missing anything.
And I mean, no, but any other signs and symptoms around ovulation, because often sometimes people can get increase in energy, increase in libido.
Yeah.
Sometimes people get negative side effects, don't they, from that peak of estrogen? Sometimes people
definitely
can get headaches.
That's exactly what I was going to say.
Yeah, sorry, Guanyum, you go.
Oh, I was just going to say, like, headaches, migraines, like those kinds of things when it depends person to person, but sometimes when the estrogen is right at its peak, people can get these symptoms, or when they experience the drop, because after you've ovulated, estrogen does drop quite dramatically. So if you're sensitive to these hormonal fluctuations, like that's why you might be getting side effects, like we said, headaches, maybe like bloating, pain even as well. That can be part of the picture there.
Yeah. Also, what's interesting, isn't it, is that they've done studies, haven't they, on women who are ovulating, and is it the t-shirt test where they've smelt different t-shirts and you have like a higher, you're more likely to have like a higher perception of like good smells, and you're basically you feel more, you're more attracted to other people and you feel more attractive yourself. So if you have one of those days, when you have one of those days and your hair just goes right and you're like, that'll do. You're not like giving that, it's done that. You're going, that's all right. That's probably because you're ovulating and you're thinking, I'll take that. I'll take that.
Yeah.
That happens to me less now, sadly. But I remember I know that's perimenopause for you. But I remember in my youth of having that kind of like times of the month where I was like, feeling pretty good. And I think that was definitely linked to ovulation. And I know that's not for everybody, but that can happen, and it can be a sign that you're in that window.
So when we think about that window, then how do you know when to time sex? Like when do you actually need to be doing it to get pregnant?
Yeah, I mean, it's a good question. In an ideal world, I think the NHS recommend that you have sex every other day from the day after your period has finished. And that is their recommended best way to cover your fertile window. And I would say it's not a bad shout, but it's a lot of sex to be having. So I often say to people that it's really good if you notice when your period finishes, you have dry days, and then you have the day where your fertile mucus becomes apparent. I would say from that point, having sex every other day through to when you have ovulated, so you've confirmed your ovulation through your apps or OPKs or however you're tracking it, that is the recommended amount of sex, because you don't want to be having sex every day, because you want the time for the sperm to recover and you want it to kind of the very best sperm to be available. And obviously it's staying alive in the fertile mucus, so you don't need to have sex every single day, but every other day is a surefire way of covering your ovulation window and knowing that you've not missed it. Is there anything I've missed there, Katie?
You didn't miss anything, but you did mention apps, and I think it's just worth saying about apps aren't always the most reliable way of knowing that you ovulated, and we're going to cover this in more detail in the future. But ultimately, if the only information you're putting into an app is your period, it's not reliable in terms of telling you when you're ovulated, just because they the vast majority of them are using algorithms. So once they've kind of established how long your periods are, so not your, there's me doing the period menstrual cycle thing. Once they've established how long your menstrual cycles are, then they just sort of do a backwards calculation of about 12 to 14 days prior to your next period. Like that's when it'll be predicting when you ovulated. And once you've got a few menstrual cycles in that chart, then the algorithm will say, it'll just put this calculation into every cycle. So if you're trying to conceive, I wouldn't necessarily recommend relying on an app if the only thing you're putting into it is your period.
Yeah. And do you want to say a little bit about things like OvuSense, or the Apple Watch now does tracking, doesn't it? So how are they different from a general app where you just put the data in? What is the difference? Because that would be quite helpful.
Yeah. So taking like OvuSense as an example, so that is a device that you wear internally in the vagina, and that is taking a body temperature. I'm not too sure if the OvuSense is a basal body temperature or if it's an average throughout the night, but ultimately it's looking for a temperature change to detect ovulation. So that's what that's doing. And then the same with Apple Watches in terms of they'll be looking at a body temperature and looking for that shift in temperature to detect ovulation. So they are collecting more data about what's happening with your body, and they're more reliable in terms of confirming ovulation has happened. I said like last time, I think it was, that body temperature won't tell you when you're fertile, but it will confirm to you when you've ovulated. And then something like Mirror, that I know more and more people are using, where you pee on a strip and it tests the hormone metabolites. So you're getting a daily hormonal reading. So that would be perhaps maybe better in terms of seeing what's happening with like your LH surge and being able to see a graph of what's going on there. But having said that, I had a client literally yesterday who was using Mirror, and according to Mirror, she hadn't ovulated this cycle. But we looked at a basal body temperature and there's a clear as day temperature rise. And on the Mirror app, her progesterone was going up, but it was very different to the chart she had previously. But ultimately I was like, well, if you're looking at your basal body temperature, like I would say you have almost definitely ovulated. So I think you need to take all of these things with like a pinch of salt and just know that your hormones can fluctuate cycle to cycle, and it might not look the same every cycle.
And I guess the thing with that is that you are measuring your through your urine, which means that it, depending on how much you've drunk, at what time of the day that you're taking it, because often OPKs can be incorrect, can't they? Or you can miss an LH surge because you are you're just like, maybe you're getting your LH surge at night and you've tested in the morning, maybe you've drunk loads of water and it's not coming up so strong. So that is often a problem that people run into when they're using urine as a way to test their menstrual cycle and their hormones. So Katie, lots of people often ask about pain and like the feeling or the sensation of ovulating. Sometimes people get like a bit of pink in their discharge at this point. Can you tell us a little bit about, is it normal to feel pain around ovulation?
I would say it's that whole saying of it's common, but I wouldn't say it's necessarily normal. Really, the same way with the period, that shouldn't be particularly painful. Like you may have like a tiny bit of cramping, but like if you're feeling like you're being stabbed around ovulation, which I know like some people will say the pain is as intense as that, or like that twisting kind of pain people describe sometimes, like that is not ideal. And it can be down to like inflammation in the body, or like raised levels of prostaglandins, which are what cause period pain. And because prostaglandins are involved in that shedding of the womb and that kind of like inflammatory process that happens there, like a natural inflammatory process in the body, it's the same with ovulation. Like some prostaglandins will be present in order to literally allow the egg to be released from the follicle. But if you have really raised levels of these inflammatory type of prostaglandins, then that could be contributing to ovulatory pain, which would perhaps be worth investigating, just seeing kind of what's going on in terms of like, are there any underlying conditions, like do you have pain with your period as well, and just kind of like noting these things there. And then in terms of seeing bleeding or spotting around ovulation, The reason that can happen is sometimes if there's a very sharp rise in estrogen in the run up to ovulation, and then that can result in a bit of spotting. I think, what are your thoughts on this? Because I would say like a tiny bit might be like not harmful or like okay, but again, ideally you don't really want to be seeing like loads of spotting / bleeding around ovulation for sure.
Yeah, I would agree. I'd say a little bit sometimes can happen as the egg literally comes through the follicle. But again, any sort of spotting mid-cycle really should always be investigated to make sure there's no endometriosis, or maybe cysts. Ovarian cysts are common and can cause pain and can cause spotting and bleeding. So it's always good, I would say, to investigate it, especially if you feel like it's happening time and time again around that time.
Yeah, definitely. So then, like, other red flags, and a big red flag would be like if you're not ovulating at all. Like, what's that all about?
Yeah, I mean, there's 1,000,001 reasons, aren't there, why you might not be ovulating. So it could be something as simple as you've done a night flight, or your sleep has been messed up and that's really stopped your ovulation. So it might be just delayed. It could be hormonal changes. So your follicle stimulating hormone is high and so you're ovulating early. Or it could be that it's low and you're not ovulating at all. It could be something to do with your thyroid. It could be just something to do with your iron levels. I mean, there's many, many reasons why ovulation can be affected, and that can be from a lifestyle point of view, a nutritional point of view, and obviously an underlying medical point of view. So I think ovulation going awry now and then is not unusual, but I think if it's going awry repeatedly, 2 to 3 cycles is definitely something to get investigated. And we've got lots and lots of episodes on what tests to do and what blood tests to do and how to make sure you get the right treatment. But I would say it's definitely something to keep an eye on, and know that a bit of change is normal, but anything longer is definitely something to look at. And wonder how many more times I can say definitely.
I hadn't even noticed you saying it.
Definitely quite a few more.
I was saying to my friend last night that I keep saying for sure all the time.
For sure.
And big time.
Big time's hilarious. That's like something my dad says. Big
real
time.
dad energy sometimes.
That is quite special. Mine's really bad because I'm 100%, and also sometimes I find myself saying 1,000,000%. That's
great.
1,000,000%. It's not just 100%, it's 1,000,000%. That's how much it's true. Anyway, have I missed anything else off around ovulation and things that can interfere with it?
I don't think so. I think they're all kind of like the key things, and the fact it can be lifestyle or medical. That there's lots of reasons why, but also like if you have one cycle a year where you don't ovulate, like that's way more common than people realise.
Yeah. Okay, Katie, I think we have literally 1,000,000% covered ovulation today, and we are going to be back for sure, big time. We're going to be back next week, where we are going to be talking all about the all-important, often problematic luteal phase. So this is the phase after ovulation where it's all about the egg and sperm meeting and implantation. So Katie, I will see you next time. We hope you have found this episode helpful. If you'd like to leave us a review, we would love you to bits. And if you'd like more support for your fertility, you can come and work with us in clinic. We're based in London and around the UK, or you can work with us online. For more information, see the link at the end of the show.